Today I want to talk about subluxation. Sublux, what? So if you were to tell your neighbor, you know, my doctor told me I got a C7 subluxation, that's my health issue, and that's what's causing all these problems, they probably wouldn't know what you're talking about. They would know cancer, heart disease. They would even know what a lymphoma is, but most people have never heard this term. And unfortunately, as chiropractors, sometimes we don't educate our patients well enough, but I want to do that today. I want to talk about this issue. Chiropractors are always correcting this. When you come and get an adjustment, it is this that we're correcting. What is a subluxation though? Subluxation is a misalignment that puts pressure and tension on your nerves. So when we talk about these movable bones in the spine, they can get out of alignment. And one of the things that happens is they'll put pressure and tension on these nerves. Chiropractors, we use very specific adjustments to correct that interference and realign the vertebra. So now that nerve doesn't have any tension or pressure on it. And what's really unique about chiropractic is, again, it's not just an alignment thing with, something's out of place. There's nerve tissue that's involved. And your nervous system controls the whole show. The brain's constantly sending messages down from the brain to all the organs and tissues, but it goes through that spine or through those columns to make that happen. But when they get interfered with, what will happen is the brain will no longer send 100% of the messages, and through time, if this is only getting, let's say, 70%, and this is your stomach, the stomach's no longer told exactly when and how much acid to secrete. So that person might get things like indigestion, etc. So chiropractors are not treating disease or symptoms like indigestion. Our whole goal is to realign the spine so that way now the brain and body can communicate and heal and regulate itself at 100%. It's amazing what your nervous system's doing right now as you're watching this video. It's filtering blood, it's kicking out stuff for your immune system. You don't have to think about it doing it. It always does those things constantly, and it's unconscious. You don't have to control it. But it will only do those things well if there's no interference in the nervous system. And that's what we correct, and that's what my challenge is for you. How do you know if you have a subluxation? Because when you look at this, you think that's painful. We have another video for that, because it's not always a painful process. Most of your nerves don't sense pain.